and to talk about the ways in which it led to an interesting brand partnership between a healthcare company and a medical device company. We have Matt Dusick, who's the Vice President of Providence, as well as Jenny Lee, who's the VP of Global Digital Marketing and Customer Experience at Boston Scientific. So please welcome Matt and Jenny.
Hello?
How's everybody doing? It is so nice to be here. It's always hard to follow, talking about children and death. I will say, my sister actually wrote that article in the New England Journal of Medicine, and my entire life, she's a physician. She's like this star child. She married a Korean surgeon man, and I'm a lesbian. Like, I'm just following in her shadows. Even at this conference, I'm following in her shadows. But we're so excited to be here. If there is an award for longest title of any topic or session of this conference, I think we also win that. But we're just going to talk a little bit about our partnership, and we'll start with our introductions of ourselves. I'll go very quickly. My name is Jenny Lee. I work at Boston Scientific. I lead our global digital marketing and customer experience team. We focus on omni-channel marketing, channel marketing, do product management, project management, and production. And I'm here with my partner in crime, Matt Dusick.
And we have a slide for that.
Yes.
You have to click the big green button.
All right.
And by the way, I'm a little bit annoyed at this photo. How did you get such a dynamic picture and my ginormous head is just poking through that circle like the rest of my body wouldn't fit, which is probably true. We have to talk to somebody. Hi, folks. My name is Matt Dusick. I serve as the Vice President of Clinical Institutes for the Providence Health System. So I am not in marketing. I'm not in branding, although I do work closely with those executive officers. I'm really on the care delivery side. So my leadership accountability is cardiovascular, neuroscience, oncology, digestive health, and women's and children. So it represents about $11 billion of our company's net service revenue. And it's been a real pleasure to be here and really learn from all the experts in the room. So it's a tradition at Providence that part of our heritage, that we begin meetings with a reflection. And the reflection is really an opportunity for us to pause and take a moment to ground ourselves in the subject at hand. It's a really neat part of our culture. So if you'll indulge me, I'd actually like to start off with a reflection. In some cases, the reflection is a prayer. In some cases, it's a quote. In some cases, it's a story. So I'm going to tell a story. And I've told this story to a couple people, over the last few days. So, if you'll indulge me in the redundancy, click, please. So when I started at Providence, I actually came to Providence from the IT world. I was a project manager at a software company. And my first job in Providence was in a hospital. Show of hands, how many people have actually worked in hospitals? Great, so you know exactly what I'm talking about. And as our leadership, as my leadership grew, and as oftentimes many of our leaders, as we grow in our career, we get farther and farther away sometimes from the people that do the work, and sometimes the actual work itself, and we tend to look a lot at data. And so this, for me, really explains, when we talk about like the tagline, world-class care with a human connection, this story is my why. This is the story that I go back to connect myself with the work that I'm doing, and remind myself that behind every data point is actually a person that's having probably a pretty bad day, or a person that had a great day because our therapy is because Boston Therapy worked, and we've alleviated their suffering, we've alleviated their pain. So, my first job was in an office in St. Vincent Medical Center in Portland, and like most people, you'd go to work, you'd turn on your computer, you'd put down your bag, you'd go get coffee. So the coffee shop at St. Vincent was right next to one of our elevators, and we color code elevators like a lot of hospitals. Ours was purple, so you can give directions. And right outside the purple elevator was the cardiac intensive care unit, waiting room. So in other words, the people sitting there were waiting for their family members to get out of cardiac surgery, or maybe they had suffered a massive heart attack or some sort of trauma. So you had people that were sitting there arguably under a lot of stress, having a really bad day. The ironic thing is that the purple elevator went up to the maternity ward. So every so often, the doors would open, and out would come new parents taking their baby home. And they had that typical, like, I have a baby look, like that glazed new parent look. And they were having arguably the best day of their lives. And that is healthcare. I never forget that. Is I couldn't go get coffee in the morning without seeing people having one of the worst days of their lives juxtaposed against people having some of the best days of their lives. And so for us, that's sort of the, I talk a lot about world-class care. I'm on the delivery side. But this presentation, I think, is really about that human connection and understanding that journey, right, that emotional journey that we all have with the healthcare system. And it is inevitable, right? Everybody here is guaranteed to have a healthcare journey. So this is about the human connection.
And that's one of the amazing things about being in healthcare. I mean, we're all in healthcare, and at the end of the day, when we wake up and go to work, it's about something more meaningful than just what's right in front of us when we put our bag down and open up our laptop. It's about, at the end of the day, there's a patient there, there's a human, there's a mother, a father, a sister, a brother, whose lives we can be positively impacting. And that's how Boston Scientific really, we come to work with that as our driver. And I think that's one of the reasons that this partnership worked so well. Just quick 30,000-foot view on BSC, in case anybody hasn't heard of us before. We're based in Boston, and it's a very creative name, I know. And I'll just draw your attention to the patients treated annually. That is what is important to us, really, at the end of the day, thinking about these patients, a Parkinson's patient who has such bad symptoms that they're not able to safely drink a glass of water or hold down a job. And then they get a deep brain stimulation device from BSC, and not only can they now drink a glass of water, they can have meaningful relationships with their partners, they can have a job, they can go out and travel and do things they never did before. So that is what BSC is all about, and partnering with organizations like Prov is so meaningful in that way. So that I think is some of the genesis, and we do have to give a nod to one of the brainchilds and orchestrators of this partnership, Xenia, who's with us today. But it really, when you think about device companies in industry and big healthcare systems, very important hospital systems, typically they can be pretty transactional. Yeah. We focus on, we are producing products that are used in procedures, and it can be that transactional experience. And this was an opportunity to take it back to the patient, right, at the end, and think about something bigger.
Mm-hmm. Next slide. So you East Coasters, I don't know how many of you have heard of Providence, but we're actually one of the largest health systems in the United States. By revenue, we're about a $26 to $28 billion healthcare organization. We are a ministry of the Catholic Church, so we report up to the Vatican, ultimately. And we cover 7 states in the western United States, so Anchorage, Alaska, all the way down to Lubbock, Texas. But we haven't always been that way. In fact, when I started Providence 11 years ago, it was a much smaller system, and we purposefully went through a growth strategy, largely through acquisition. So you can see on one side of the slide here, all of the different brands that kind of came out of the work that we did, either through acquisition or project development. We developed new companies. We have secular health systems that are part of the overall corporate umbrella. And it's a bit of a mess. And so really starting in 2019, we started to go down this journey to unify this house of brands into one single Providence brand. So we have an overarching brand that's just Providence. And that is reflective of, as you can see, secular systems, other local market brands. And when it comes to specialty care, we kind of doubled down on that. So we took all of the local brands, the Pacific Heart Institute if you're in Santa Monica, the International Heart Institute if you're in Montana, the Swedish Heart and Vascular Institute in Seattle, for example, and move those into a single specialty care brand. So we have one Cancer Institute, one Heart Institute, one Digestive Health Institute, one Women's and Children Institute, et cetera. And to make those brands not only in a way that resonate in the local markets, but also represent a national footprint. And so really expanding the reach of both our system and our specialty care. Next slide, please. And so the idea was, this is really how we're starting to express that brand. So in other words, as we simplify we start to really highlight the connectivity, right? So it eliminates some of the confusion from our patients to say, well, are you part of Providence? Are you part of Providence? If I go from this hospital to this hospital, am I still with Providence? So the idea is to really simplify that brand experience, put that physical experience forward in our hospital signs, our lab coats, and really help our patients and providers understand that they're actually part of a network of specialty care that in some cases extends all across our enterprise. As we were moving forward in the brand journey, we were also starting to be a little bit more intentional in our social media strategy. So we started to expand our Facebook, our Instagram, our LinkedIn. Part of that was also launching our Future of Health Radio content starting in 2019. So you can see here, we started small and we currently have 18 podcasts. They cover a variety of topics and began a partnership with Dash Radio as the primary platform. You can see from the numbers that's grown quite a bit in the last 4 years, from 25,000 to over 250,000.
I'm curious, does anybody listen to Dash Radio? It was relatively new to me. Awesome. Okay, you don't have to be
Thanks,
ashamed.
Sam.
No shame.
He's
No
like-
shame here. Maybe me. It is a great platform. There's a lot of celebrities who have their own channels there. It's ad-free, and it's super interesting. And as you know, podcasts are a growing platform, which is one of the things we're going to talk about, because it was an idea that was baked out of essentially just a relationship. A customer and at Boston Scientific were talking, and they said, we have this really, really important subject of men's health. And there are a lot of procedures that men specifically, assigned male at birth, need to have as they go through life. And sometimes it's not the most comfortable thing to talk about. So what would be a great platform to do it, to kind of educate and make consumers aware of what's out there? And this idea of a podcast hosted on Dash Radio platform, but then also spreading to other platforms as well, came up. And so we're going to give you a little snippet of this His Health podcast.
Hey there, everyone. I'm Rick Malambry, and I'm the host of the new podcast, His Health, the show where we're tackling the health issues that are most important to men. We're going inside the topics that men of all ages need to know and taking you out of the comfort zone when it comes to those health issues that men don't normally like to discuss. In this week's episode, I speak with Dr. James Kwan, the urologist with Swedish Medical Center, about erectile dysfunction, a topic that may not be easy to talk about, but is much more common than we realize. So make sure you tune into Dash Radio this week on Monday, Wednesday, or Friday at 5 p.m., or look for His Health on your favorite podcast platform. And lastly, don't forget to subscribe so you can tune into more of our future episodes.
So we will see your vagina videos and raise you erectile dysfunction.
Yes. Really, so I was in the urology division at BSC for quite a while, and you get comfortable talking about and seeing all the things out there, but still consumers aren't always so comfortable in talking about that. So having a platform where you can just sit in the safety of your car or on a walk and listen to real patients who have had these same issues and speak with a known expert, a physician who performs these procedures, is pretty powerful. And the results from these, we weren't sure what to expect. I think when we went out, we thought, okay, maybe we'll hit a couple people and maybe it'll be regional. Are we gonna hit our right target audience? What we found, over 85% of the listeners were male, so we were hitting the right target. Maybe 15% were, listening for their loved ones in their lives, or physicians as well. We also found that podcasts in general, we're hitting the right target age range. We're looking at 35 to 54 age range, which is right in our target market. So we saw that through this platform, we were hitting the right consumers with the right messages at the right time. From the His Health podcast, kind of birthed another, I think, generation of podcasts with Prov. You want to talk a little bit about Heart Matters?
Yeah, so as we were thinking about how could we could take the His Health, which was at the time a little bit more of even a local podcast, and marry the Heart Matters concept with the idea of a unified Providence Heart Institute brand. in a way that we weren't necessarily promoting individual hospitals or doctors, but really just using that to get the name out as a thought leader or thought leaders within a national footprint. And one of the I think two of the really interesting parts of this was, number one, we had a goal to not just talk about some of the more standard things of heart health. So, you can only hear so many times the signs and symptoms of a heart attack, or, that you shouldn't smoke, that you should watch your cholesterol. I mean, those are important things to reinforce, but that's out there, right? I mean, you can get that from most podcasts, Medium. We really want to talk about things that were out of the box. So in one of our episodes, we interview a psychiatrist. It's called Knowing versus Doing. So we talk about how come what we know are good habits are sometimes hard things to do, right? We know that smoking is bad, yet people smoke. We interview another person about anxiety and depression and how that affects heart health. We talk about food as medicine. We talk about barriers to care with a leader within Boston Scientific. So the idea was to kind of look at some out-of-the-box topics that will still educate people while reinforcing kind of the tried and true public health messages. Yeah, so that was a big goal.
That's right. And if we just reverse real quick backwards to how did this start and kind of what were the keys to success for the partnership? It started like anything else. It was a conversation. It was an idea. And I think Matt listened to his health podcast and was like, why don't we do this in the cardiovascular space? There's a huge need, lots of people impacted by this, lots of opportunity for education and awareness. Mm-hmm. So if you think about the top of the funnel and bringing people in, we can either reach people we're already reaching but in a different medium, or we could reach an entirely new segment of consumers. So we just had a discussion, said, hey, this is an idea. It's not typical for how we work together, but would you be open to it? And so then we had 14,567 meetings with legal and compliance and privacy. And, quickly thereafter, we formed this fantastic partnership. And I think that was really a key. We'll pull it together in the Keys to Success slide, but it really was like we collaborated with the right groups of partners in our internal teams. We both had this kind of branded house versus a house of brands. And we ultimately had this same mission objective of reaching patients, looking at consumers at the top of the funnel in order to improve their overall quality of life, their lives. So I think that all worked. We kind of built this I'm pretty anal retentive, so we built this very detailed plan, and now we have, 20 podcasts, I think, planned, and already 11 are launched. Yeah. I've been listening to them on my runs, and they're super good. They're super interesting. I don't have a cardiac issue. Nobody in my family does, but they're just really dynamic. You keep them in layman's terms. Even I can understand them, so they're really, really good. Highly recommend.
Yeah, I will say that I did not start this project thinking that I would be hosting a podcast. But, everybody stepped back. And so I went out and recruited my wife, who's actually a healthcare executive herself, yeah. And one of our doctors, doctor by the name of John Wagner. And so we sort of all collaboratively host these episodes. We take turns. I realize that I am the Fredo of the Corleone brothers of hosting here. They're so much better. But, the other piece was, in addition to wanting to look at some out-of-the-box topics, or maybe some topics that aren't always top of mind, the other important thing was really to explain what in some cases were very complex issues in a way that could be easily consumed regardless of who the listener was. So this isn't sort of an industry podcast. It's not meant necessarily for doctors or health plans, really represented for everybody that would be interested in heart health. And so here's a clip of one of our doctors explaining atrial fibrillation.
Kind of analogous to when you come down the stairs and you see that light bulb in the kitchen flickering. That's kind of what happens in atrial fib. Your upper chamber starts having a mini short circuit and it starts flickering. And usually the first time you see the light bulb flickering is not the first time it happened. You just happened to be down the stairs and you saw it. Well, we know what happens over time with that light bulb flickering. Like atrial fib, the episodes of flickering get longer. They become more frequent until that bulb is flickering all the time. And that's what happens with AFib. It's a progressive disorder.
Yeah, the other cardiologist on the podcast, we interviewed two in that episode, described it as a fish flopping around in your chest. And if you've ever experienced a bout of AFib, it actually really does kind of feel like that.
So they really do talk about it in a very relatable term, mm-hmm. where you think anybody could listen and digest the content there. So we'll just wrap it before we head to questions to talk about what were the keys to success of this kind of unassuming partnership where we started 6 months ago and didn't really know where it was going to land. But I think number one, starting with the aligned mission was huge, making sure we were both on the same page and having that branded house and thinking about driving awareness for both organizations. And I think the relationship was great. We had a super open, honest relationship from the start. We had to pivot many times, and that is okay. I did mention the privacy, legal, regulatory compliance discussions, and we were just open to it and flexible, and everybody on the team was just willing to pitch in and figure out how can we make this work, because at the end of the day, it's for the prospective patients and current patients.
Yeah, you mentioned before, Jenny, it's worth mentioning again. I mean, the relationship between a healthcare provider or a healthcare system and industry so many times is just transactional, right? And it's kind of built around a zero-sum game, is that Providence does not make rhythm devices, we don't make cardiac stents, Boston Scientific does, so we want to obviously pay as little as we can. Boston wants to grow their revenue, and that will probably happen until the end of time. But really the goal, because the problems in healthcare, and I'm sure Northwell faces this as well, I'm sure Virtua Health faces this as well, the challenges are so big nowadays that we can't do it alone. Like, healthcare systems cannot go in it alone. We need to find partners that can help solve those problems, help reach more people. In some cases, that's industry. In some cases, those are payers. But I think it's really important to start to look beyond the transactional relationship that we've historically had and really start to think about strategic relationships where we can come together outside of our traditional book of business. And this is a great example of that.
100%. So where are we taking this next? So we have a couple ideas of where we're going, and I think over the next 6-12 months we're going to be launching more patient testimonials across both of our platforms. We'll be doing social media live events. We'll continue with the organic and the paid boosting for all of these episodes, which we're already seeing 2 to 5x listenership above the podcast typical listener volume. So far, early indicators are all looking strong. We'll keep talking to our CFO about the revenue implications, but it's been an awesome partnership, and so we're happy to take any questions with that.
Matt and Jenny, thank you so much. Questions? Oh, sorry. Okay.
Fascinating presentation. In other sectors, you see partnerships like this quite often. Mm-hmm. Like, we worked with Emirates Airline for many years, and every time Boeing or Airbus had an aircraft in either a commercial or some other platform, it was paid 50% by the manufacturers. Do you think that this is going to become a more common practice moving forward in this sector?
I do. Yeah, no, Jenny doesn't know yet, but we'll be hitting them up for other specialties as well. So, yeah, I mean, if you look at the economic headwinds that health systems are facing right now, famously, right, Kaiser, an integrated system by any definition, posted a $4.5 billion loss, right? Cleveland Clinic, almost $2 billion. Providence, almost $2 billion. And you can go right down the list. Mass General and Brigham, almost $2 million. There are tremendous again, headwinds that hospitals are facing and health systems are facing, and really looking for those sponsorships, looking for those partnerships and investments. I just see that as critical to the next probably 3 to 5 years.
Could you dig deeper into your respective KPIs for this? What measurements of success were you using, and how did it perform? And were there any have there been any optimizations along the way?
You want to talk about that?
Yeah, for sure. So we have a dashboard that we're tracking too. I think, our general listenership isn't that of a consumer brand podcast. We wouldn't imagine to be like SmartList or one of the others, but we are basing it off of our baseline from prior podcasts. And so we're very, very pleased with where we're going. I think what will be interesting to see if patients start coming in to physicians, either because they've heard them on the podcast or they reference, oh, I heard that this was a potential symptom. I just listened to the Women's Health and Women and Cardiac Health, is that the name of the podcast? And it talked a lot about women waiting too long before they go into a hospital with cardiac symptoms. It'll be interesting to see if women hear that and then present with a physician earlier because they were informed through a podcast. So there's even those kind of intangibles as well. From a BSC perspective also, we're looking at our relationship. I'll just pretend Matt's not here for that. And looking at, what type of, how our relationship is strengthening with Prov as well through this.
And Matt, since we're talking about health providers behaving a little bit more like a media company, let me ask a sort of a classic media company question. Are you also selling sort of audience extensions to this in order to heighten awareness of both this particular co-branded program, but the podcast in general? Are you buying media? Are you charging Boston Scientific to help you go out and buy media against this project?
We are. This project is fully sponsored by Boston Scientific. So outside of the physician time, the host time, and some of the social media team on our end, we're fully sponsored. We're using it to, sort of buy exposure and visibility in other markets.
So you're a little bit of an agency now, too.
Yeah, that's right.
Okay.
And I think one of the learnings that we have is that it's been great. I'm going to move forward with looking at content more holistically. How can we leverage that content in the broad-based content supply chain that we have, and how can we modularize it as much as possible versus just in this kind of like, oh, one-off, we're having a partnership over here. So that's, as we grow partnerships like this, we're going to shift into that more kind of 360 model.
Barbie?
Hi, actually building off of what you were just talking about, I'm seeing engagement as a huge trend. Just the last few days, I've talked to a lot of people about how building that engagement with consumers, patients is really important. And obviously, you're working really hard to build this human connection through the podcast, but how else are you doing that on other platforms and other ways? I'm curious if you're working together on that or separately and what you're working on.
Yeah, that's exactly the direction we're headed. We're looking at other platforms. I mean, your typical players, Facebook, LinkedIn, Twitter, nothing shocking there, but we are looking to continue to build out with other events. But how amazing would that be to do a live event where patients can ask live? We do see, with Men's Health, they are sometimes more hesitant, but in something like cardiology, they would be much likely more open.
Go ahead.
Great presentation. It's absolutely fascinating to think about what the partnership between these two entities can do, especially leveraging Providence level patient data to drive the design of the content. And my question is, even beyond the awareness piece, getting into the actual, like, patients suffering from AFib, for instance, being able to use this content to help drive outcomes. And if so, why not bring a payer on board to complete the relationship trifecta?
Yeah, we've talked about some sort of initiative that really does involve both industry partners, payer partners, and then the healthcare side. As you can imagine, it's incredibly complex and it's slow going. You talk about all the legal discussions, all the various, but no, I think that would be the next frontier.
Go ahead.
Hi, Andy Cotton from Ad Media. Great presentation. First of all, I came down that purple elevator twice with both of my kids, so I'm very familiar with that slide. So very cool. It kind of choked me up there for a second. But curious question with the partnership that you guys have had. Have you looked at how it's lifted your individual brand campaigns separate from the efforts, and where that could help foster more partnerships if you start to publicize that as well?
Yeah, it'll be interesting to see. So we're not as advanced as Northwell. We don't track our brand equity monthly. We do ours more annually, biannually. So we will be looking at that. And honestly, ours is more typically focused on the physician versus the consumer. So as we start to expand our brand equity tracking, we will definitely be looking at how this, but it's too early for us right now.
And the impact of this right now is too early, but we do track. We want to be the number one or the number two brand in all of our markets, for example. We have other activation and user metrics on our app or other sort of, access points. Yeah. I will just leave you with this, because this is a nugget that I got from the podcast that just kind of blew me away. And so it's not necessarily a plug for the podcast, but I learned that loneliness is equivalent to smoking a pack of cigarettes a day. So if you think about mental health and cardiac health, right, loneliness is like smoking a pack of cigarettes a day. So it's things like that that we're really trying to promote. That's not necessarily something that's going to, bring patients in the door for Providence. We don't make money on behavioral health, even if they did. But the idea that we're trying to reach people in areas that they might not have thought about when it comes to their heart health, that's really the important part, and that's what I'm grateful for with Jenny and the partnership.
Matt and Jenny, thank you so much.